The doctor is in, and today we are talking about taking charge of your health. We all know how busy doctors can be, but what can you do to get the most out of your visits with your physician and your health care team? So joining us today is Dr. Scott Ackerman. He is one of the First Coast's leading oncologists. Thank you so much for being here, as always.
Thank you, Casey.
You know, this is really something that a lot of people talk about, and there's some people that get nervous when they go in to see their doctor because they think, I only have so much time with him or her. I want to be able to maximize it and make sure that I know exactly what my issues are, problems are, questions, make sure that they're answered before I leave. So give us advice from an expert. What should we do?
What you're talking about is exactly right. Patients are nervous, they get a little flustered, they only have a certain amount of time with their physician. Then when they leave, they realize I forgot to address this, I forgot to do that, and they don't remember. So I have a few pointers that I give people about what they could do to make sure that they optimize their time with the physician and make sure they absorb the most and get the most out of it. First of all, put a file or a journal together about your medical history to keep for yourself. In it, keep all your test results, the list of your medications, the procedures you have done in the past, the dates of those procedures. Just keep that as a running file and update it periodically. And that way when you go to the physician's office and they ask for the stuff, you don't start thinking about, well, what did I have done when or whatever. You can give them a piece of paper. Nowadays, I have a lot of patients that just print out on their computer before they come into the office, and they give it to my staff, and it has in there all the medications, all their past medical history, all that sort of thing. It gives us all the information we need to make the best decision for a patient's health. And especially as you get older, you get more illnesses, you're seeing multiple doctors, and so not all those doctors are on the same medical, don't have the same medical chart on you, or they're not, even though we have this electronic medical record. Not all of our electronic medical records talk to each other yet, so we don't have all the information together. So it's really helpful if you have multiple doctors to have this, so you can give it when you go to a new doctor, or even your old doctor when you're going back again, to give him or her an updated list of everything that's been going on with you.
And it's so good to be your own advocate, right? I mean, no one knows your health better than you and what you've done. I mean, and you're seeing, I'm sure, more than one patient in a day.
Right.
So to be able to stay on top of everything, it's just good to have that information. The information is power. So what other tips would you recommend that we try to keep in the back of our minds?
If you're going to a physician for a specific diagnosis, I suggest that you prepare a list of questions that you're going to have prior to your appointment. Write it down on a piece of paper, take it with you. The time with the physician is limited, and you may be distracted by something he or she might say to you, and you might forget to ask certain important questions. So write down the key questions you want to get out of it before you go. Patients do this with me all the time. They come in, we're done our visit, we got done, Mrs. Smith, we're all done, we'll see you next week. Wait a second, doctor, I have some questions here, I want to make sure I got them all answered. And I love that. That's a great thing, because I certainly don't want to leave any loose ends out there. Many times those questions were already answered, but sometimes they weren't, and it's good to them be able to fill in the blanks.
Well, knowing me, I would get in the parking lot, I'd be driving out, and I'd be heading somewhere, and I think, oh my gosh, I forgot to ask this question. What if you've already have left and you have forgotten to ask a question?
Well, if you already forgot to ask a question, my advice is to call the doctor's office and ask to speak to the doctor's nurse. The nurse can access the doctor very quickly, and maybe he or she, the nurse, could answer the question themselves for you. And that's what a lot of my patients do. It's very helpful to them. If not, then you get a message to the doctor, and the doctor will probably either get the word back to you through the nurse or call you his or herself.
But it's important to take that step, because sometimes I feel like, oh, I don't want to bother him. I know he's busy.
It's good.
But it could be extremely important if you're doing this or that or the other.
Absolutely, absolutely. And also bring someone with you to the appointment, because this person could help remember things. This person, when you're in there with the physician, especially in what I do in cancer, patients are very much overwhelmed. And I embrace the fact they bring family members or neighbors or friends from church to come with them, because the second person is a second set of eyes, second set of ears, and they can take notes, and they can make sure all the questions get answered properly. It helps you, the second person can help to coordinate their treatment or help reduce the stress, because you then can focus on things. And not just a second person, you can bring 2 friends too, you know, it's even better. I tell this to all my patients all the time. I strongly suggest they bring someone with them. And then when you leave the office, less chance you'll forget to have asked something because the friend would bring it up. And the friend can also act as your advocate and help call the office
Well,
too.
and I can imagine there's a lot of emotions, especially with you in oncology, that, you know, you're hearing news that, you know, a lot of people don't really ever thought that they would be hearing, and so you're so fixated upon that you're not really listening to much else, because there's, I mean, it's very difficult. I can't imagine, but I would imagine it would be awesome, or it would be much more beneficial to have a good friend there or a relative to help you along the way. So Dr. Ackerman, thank you as
Thank you,
always.
Casey.
We appreciate you being here. And of course, if you ever have any questions for Dr. Ackerman, you can email him, or you can actually go to the website, which is firstcoastoncology.com. And if you have anything that's on the top of your head, perhaps it's this segment, or if there's another segment that you saw in the past, or questions for the future, again, just go to firstcoastoncology.com, submit your questions there, and they will get back to you.
Click on Ask the Doctor.
Click on Ask the Doctor. Don't forget that part.